Good evening and welcome to a webinar that we are doing this evening from the San Diego Fertility Center offices, where Dr. Friedman is and myself in London, with our amazing friend and colleague Brad from Same Love Surrogacy. Today what we're going to do is we're going to talk a little bit about the process of IVF and surrogacy and how it all works. We're also going to be taking questions, so if you have any questions, please put them into the drop-down box questions and we will get to those either at the end of the presentation, or if it's pertinent to the presentation, I will jump in and interrupt. Sorry, Dr. Friedman, sorry, Brad, that's what I do. So we can talk about that. I think one of the most important things, as has been the case for the past year, is talking about COVID and the impacts of COVID on this process. So the format today is Brad is going to start. He's going to talk a little bit about the surrogacy side of things. Then Dr. Friedman is going to jump in and talk about the IVF side of things, egg donation side of things, the medicals, and then we'll move to questions. So what we're going to do today, we've got a couple of presentations. So Brad is going to be doing that first, and then Dr. Friedman is next. So Brad, you are now a presenter, so all yours.
Great, thanks Richard, and thanks everyone for joining us today with the webinar. And thank you to Dr. Friedman for joining me. And first thing I want to talk about a little bit is just about our agency, Same Love Surrogacy, and then we'll get into the more details about surrogacy. Our agency, we're a full service global egg donor and surrogacy agency, and we have offices in Los Angeles, New York, and Portland. And we've been in business since 2014, building families. The great thing about New York right now, and we'll touch about this a little later, is surrogacy is now legal in New York. So that's a great opportunity for attendant parents to have a larger network of potential surrogates. Our agency is 100% gay owned and operated. The owners and founders of the agencies are gay fathers that have gone through surrogacy. And that was really the inspiration for our agency and why we really cater to the LGBTQ community. And you'll see, 85% of our attendant parents come from the LGBTQ community, and we're really proud of that. Very proud of the parents and the families that we built around the world. One thing you'll get with our agency is excellent customer service. We're always available on weekends and evenings. We realize that surrogacy is a very important and stressful process, so having that touch point and having that access to owner is really important. Our attendant parents are globally diverse. We have attendant parents coming from all over the world, Europe, Asia, and in the US. And 35% of our attendant parents actually come from Europe. And me and Dr. Friedman, we do a lot of attendant parents and consultations with European attendant parents. One thing we really strive is we work around your schedule. We know that all of you are very busy. There's time differences. So we're gonna make time for you. And we also have many employees on staff that can help with translation services. So if you speak a different language and you want to have a consultation, we're able to provide translation services. With our agency, you have access to our egg donor database, which has over 200 profiles for you to review. And the best part about San Diego Fertility Center and Same Love Surrogacy is we're in California, and California really is the world leader in IVF, egg donation, and surrogacy, and it's really the safest place to form your family. And it's just a big advantage having both your agency and your IVF clinic in California. A little bit more about Same Love Surrogacy is all our employees, we have a connection to surrogacy. Either we've been a surrogate, we've been an attendant parent, we've been an egg donor. So that's a really special to have that connection with your agency. One thing we're very proud about is 91% of our surrogates come back for their second journey. So it shows the amazing care you get from a clinic like San Diego Fertility Center, an agency like Same Love Surrogacy. You have that knowledge that your surrogate is taken care of during this journey. 2 of our employees are registered nurses on staff, and we actually have an MD that also is on staff. So you have that medical experience at an agency. And the most thing that we're really proud about is our surrogate coordinators. These are the individuals that are going to be supporting your surrogate during this journey. And we have, all of them have either been a 1 up to 5 times surrogate. One of our surrogates has completed 5 surrogacy journeys, so we're very proud of that. Let me talk a little bit about the Same Love Surrogacy approach and how we work, with San Diego Fertility Center. Is we're going to help you build your team. You have two of the components that you need right here, with an agency and an IVF doctor and clinic. And really the last thing is just an attorney that's going to represent your legal. So you're really speaking today with two of the three players that you'll need during your journey. With our surrogates at Same Love Surrogacy, all of them are fully pre-screened. So this means before they go to San Diego Fertility Center, before Dr. Friedman sees your egg donor or your surrogate, they've already gone through a psychological evaluation, a background check, an insurance review, a home review. We've reviewed their medical records. So you can be assured that before your egg donor or your surrogate goes to the clinic, that they've already passed a lot of pre-screening. We only take about 1 to 2% of the donors and surrogates that apply to our agency. So you know for sure that that's been taken care of. I'm going to talk a little bit about the detailed match meetings with egg donors and surrogates. And I think this is really important to understand, that you will have the opportunity to meet your egg donor, at least virtually. The industry is really moving to more of an open donation. There are still anonymous donations, and that's great, but you have that opportunity to talk to your egg donor, talk to your surrogate. And this is important because this is when you can ask questions about COVID, the impact on the surrogates, if your surrogate, if your egg donor has been vaccinated or not. These are important decisions that you can talk to your surrogate or your egg donor about. And the last thing is that we're going to have access to our professional providers. So during this journey, you're going to have access to social workers, insurance brokers, genetic counselors, attorneys. All of this is going to be at your ready when you work with an agency. One thing that we really pride ourselves is we realize that IVF is an expensive process, and we want to make sure we keep the compensation fair for everyone, both the donor, the surrogate, and the intended parents. With our agency, we have egg donors and surrogates throughout the entire US, but primarily on the West Coast, where San Diego Fertility Center and Same Love Surrogacy operate. So you have that close touch point with many of our surrogates and egg donors. And the most important thing is the continual guidance throughout the entire partnership with the team here. Here's just a quick photograph of some of the monitoring and support events we do. The middle picture is a lunch we put together with all of our surrogates. So your surrogates are really supported, and that's really an important process during the journey. So let me talk a little bit about what a San Diego Fertility SLS journey looks like. The first step is you can take a free consultation both with Dr. Friedman or myself, and we're going to walk through the entire process. We're going to make sure you're fully informed, you understand the services from the agency and the IVF clinic, and we want to make sure you know your expectations up front. The next step is to identify an egg donor if you need an egg donor, or a surrogate based on your timeline. So if you're looking to start your journey in the next few months or 6 months or a year, we'll start that process of searching for your egg donor and for your surrogate. The next important process is scheduling your in-person examination. San Diego Fertility Center will explain the detailed examinations that's done at the clinic, and there's opportunities to have these exams done in Europe and not have to travel if you're outside of the US. Our agency is going to assist you with the screening process of your egg donor and surrogate. So this means your egg donor is going into the IVF clinic, your surrogate is going into the IVF clinic, and an agency like Same Love Surrogacy is going to help coordinate that. So making sure that all the tests are completed. Once your egg donor, your surrogate is medically cleared, we're going to assist you with an attorney and setting up an escrow account. And then the last part is the medical cycle. And this is what Dr. Friedman will speak about, is the steps and the medical side of getting your surrogate pregnant, having an egg retrieval with your egg donor. And the last step is really the fun part, is the pregnancy, communicating with your surrogate, having that interaction with your surrogate, and having that end result of a really healthy pregnancy at the end of the journey. It's important to talk a little bit about cost. An average cost for a surrogacy journey for a singleton ranges between $155,000 and $165,000. That's kind of the industry standard, kind of the average. So it's good to know your total costs for everything. Our agency has very transparent agency fees. So there's a very low initial deposit to start with an agency. And the time frame that we've been seeing from when you begin your journey until you're holding your baby is about 17 to 18 months. So this is the embryo creation, and this is getting the surrogate pregnant and the pregnancy for gestation. So we've seen about 17 to 18 months on average. The great thing about the San Diego Fertility Center and Same Love Surrogacy partnership is we have a team of IVF and surrogate professionals that support your case. Dr. Friedman and myself, we're communicating, bi-weekly. We talk about our cases together. So you have that team approach. And we've been building families with them since 2014. So you have, over 7 years of experience with the San Diego Fertility and Same Love Surrogacy team. One thing that we're really proud about is our success. Over 83%, about 83% of our attended parents, they become pregnant on the very first embryo transfer. And that just talks to the success of an IVF clinic, the success of a healthy egg donor, the success of a surrogate. So the success rates in the United States are very high at 83%. With that, I will turn it over to Dr. Friedman to talk a little bit about the medical procedure and San Diego Fertility Center.
Right, before you do, I've just had a question that has come in.
Sure.
You go back a slide. It's to do with two things on this. One says, is the 155 to 165 the agency costs or total costs?
So total cost. So this would include the agency costs, the IVF clinic costs, the compensation to your egg donor, surrogate, health insurance costs, and your legal costs. Those are really the buckets for expenses, but this is an overall cost.
And then the other question was, has COVID affected 18 months?
So COVID's added probably maybe a month or two to it. What we're seeing is it has delayed a little bit the waiting time for a surrogate. What we're seeing right now is as the US is coming out of the pandemic, a lot of the surrogates in the US are saying they want to enjoy the summer, they want to see loved ones they couldn't see during COVID. So the timeline has been a little bit extended to find a surrogate, and that's kind of industry standards right now in the entire US.
Brilliant. Okay, fantastic. Thank you so much for that. Dr. Freeman, you are now a presenter.
Perfect. Thank you. I'm going to just start my slideshow here in just a moment. All right. Well, thank you so much. There we go. So I am Dr. Brooke Friedman, one of the fertility specialists at San Diego Fertility Center. And I'm really excited to be here. Thanks for joining us. And big thanks to Brad. So San Diego Fertility Center and Same Love Surrogacy are independent, but we work closely together. And I think that's really important. And we can certainly talk more about it. I think Brad hit upon some really important points about how smooth the process is when we get to work together in terms of SDSC and the Same Love journey, since we've been doing this for quite some time and we have great communication between the teams. So from start to finish, you're in great hands. So we love working with Same Love. So we're excited to be able to be talking about how this works together. So I'm fortunate to be a part of San Diego Fertility Center, and I have 4 other physician colleagues who are excellent, and there's some pictures of us here. We are based in San Diego. We do have multiple locations within San Diego and a New York satellite. We offer the full range of comprehensive fertility care. So IVF, IVF with surrogacy, egg donation, embryo banking, egg and sperm freezing, pre-implantation genetic testing, family balancing, sex selection. We'll be talking a little bit more about the medical aspects of that. So I'll be talking a little bit about IVF with PGT, pre-implantation genetic testing, and IVF with egg donation and surrogacy. And then, of course, we have to touch base about COVID and how that's impacted things. So first about IVF. So what is IVF? I'm sure everyone is familiar, but just to break down the medical components, the first part of IVF is ovarian stimulation. Either a woman is taking injections if she's going through the process to retrieve her own eggs, or an egg donor is going through that process. And typically those injections last for about 10 days. And the egg retrieval is something I do, which is a surgery under anesthesia. So the patient doesn't feel any discomfort. It takes about 15 minutes. We take the eggs out, and that same day, we're going to fertilize the eggs with sperm. So if this is a journey with intended fathers with 2 sperm sources, let's say we get 20 eggs that day, we're going to separate the eggs and have 10 eggs for each partner and inject 1 sperm into each egg. We're going to create embryos. We're going to grow them in the lab. We're going to freeze them. And then at a future date, we're going to transfer the embryos either back to the intended parent or to a surrogate. So here are some pictures of embryo development. You can see on day 1, it's what's called a zygote when we check for signs of fertilization and the embryos grow in the lab. I still think it's pretty incredible. Even after all these years, I still find it amazing when I watch this embryo development. We grow them in the lab for up to 6 days typically, and we typically freeze the embryo after it's grown in culture for about 5 to 6 days. So we also grade the embryos based on their appearance. It's a little bit of a beauty contest. They get grades such as A, B's, and C's based on their appearance, and embryos with the best grade are more likely to implant than those with lesser grades. And many critical features of an embryo can't be seen, and therefore we can't assess the genetics of the embryo without doing a biopsy for genetic testing. So again, some of these invisible features are the chromosomes or the genetics of the embryo. So PGT, or pre-implantation genetic testing, is how we evaluate the genetics of the embryo. It used to be called PGS, so sometimes you'll hear people refer to it as that, which is fine. I know people just tried to change the nomenclature to be confusing. So PGS, PGT, it means the same thing. And that involves doing a biopsy of the outer cells of the embryo. These are the cells that become the placenta. We're not touching the inner cell mass, which becomes the fetus. And so for these outer cells, we're doing a biopsy and taking about 3 to 5 cells from an embryo that has over 100 cells. We freeze the embryo and we wait for the genetic testing to come back, and that takes about 10 days. So for us as women, our biology is unfair. As we get older, our egg quality goes down because we have an increasing number of missing or extra chromosomes in our egg and therefore embryos. So for a donor egg IVF cycle, the majority of the embryos would be expected to be normal, but even in an egg donor cycle, up to 30% of the embryos could have missing or extra chromosomes. It can be harder to find that normal embryo as we get older as women, and this is one reason why certain intended parents choose to pursue egg donation. We know that genetic testing in women who are older certainly can improve the percentage of live birth with IVF. So in terms of genetic testing, certainly for women using their own eggs over the age of 37, PGT is recommended. Sometimes it can help reduce the risk of miscarriage because we're evaluating each embryo and ruling out those missing or extra chromosomes. If patients are interested to know the sex of the embryo, then we will have that information because we'll be able to know if the embryo is 46XX versus XY. So we'll be able to tell you if the embryo is male or female. And sometimes if we have intended parents who both the egg and sperm source have a copy of the same mutation, like cystic fibrosis, we can do genetic testing to look for disease. So this is an area that can be a little confusing, but in general, when we're doing PGT, we're not looking at disease-causing mutations. We're just counting the number of chromosomes in the embryo, ruling out those missing or extra chromosomes. So in terms of IVF with egg donation, so we have an egg donor database here. Same Love Surrogacy has a wonderful egg donor database as well. And we've talked about this a little bit, but there's many reasons why someone may choose to pursue IVF with egg donation. Clearly, if we have a same-sex male-male couple, and for intended parents in a heterosexual relationship, if the woman is older or has lower egg supply, this could be the best option for them. So as Brad mentioned, in the US, egg donation is legal and it can be confidential. There's different contracts that can be entered into in terms of being anonymous, semi-open, or open. And you can pick a donor really based on what's important to you. Based on the profile, you'll get information about appearance, ethnicity, education, employment history, family history, egg supply testing, and the donors are pre-screened for all of these things as far as genetic diseases, infectious disease. They have a consultation with the psychologist. So all of this is done before you select your egg donor. So we do have over 250 egg donors. They are the vast majority local here to San Diego, and as I mentioned, they're pre-screened to the program. And the nice thing is, though, when you're a patient with San Diego Fertility Center, there's absolutely no requirement to use one of our egg donors. So we've had a lot of successful surrogacy journeys working with Same Love Surrogacy where they've used one of Same Love Surrogacy's egg donors, which is great. There's absolutely no requirement to use one of our egg donors. It's always good to have options. The only thing that matters to us is that you pick the egg donor that you feel is right for you. So as far as surrogacy, so as Same Love mentioned, they have a lot of international patients. We have a lot of international patients. About 40% of our patients are international, the vast majority coming to us for IVF with surrogacy. So this is really part of our passion. We do travel frequently. Prior to the pandemic, we used to travel frequently to Europe, and hopefully that will resume at some point. And what was done previously, and again, we can talk about how COVID has changed this, is that some of our international intended parents, if they were using their own eggs, could start the cycle back home and then fly here closer to the egg retrieval. The other option, which we have developed and really streamlined, which has been working beautifully, and thanks to Richard, who's been absolutely instrumental in facilitating this, is we've identified different locations and different fertility clinics in Europe where our international patients can freeze sperm and do the FDA testing and then ship that sperm to us so that we can utilize it for an egg donation cycle. So the good news is that the success rates with fresh or frozen sperm are the same. So we really can be rest assured and feel confident knowing that that frozen sperm is just as good as if it was provided fresh for the IVF cycle. And it is a very transparent and legal process. So there's a lot of things that go into selecting the ideal surrogate, and I think Brad already did a great job touching on this. Our role at SDFC is also to help screen the surrogate for you. So what happens is after a match, after Same Love sends us a match sheet, we request the medical records. They send us the medical records, and we go through all the history of the surrogate with their medical records, confirming that everything looks great. One of the things that we enjoy most about working with Same Love Surrogacy is they do a great job pre-screening their candidates. So sometimes different surrogate agencies have different amounts of pre-screening they do of their surrogates. So it's nice that you can rest assured knowing that Same Love has already done a lot of that pre-screening for you. So when they present a candidate to us, we're always really excited to review the records and see that she's a good candidate. So we review the medical records, and then the surrogate needs to come to our clinic for an in-person medical exam. And this is an important part of the process where we meet with the surrogate, we check their vital signs, we do blood testing for hormone testing, infectious disease testing, and drug testing. And we do a special ultrasound called a saline sonogram, where we look at the inside of the uterus to be sure it's a perfect place for pregnancy. Some of those high success rates that Brad mentioned, which we're very proud of, really are a culmination of a lot of different factors. We're very proud of our IVF lab. We're also very proud of our screening process to help find healthy surrogates, ensure that a woman is a healthy surrogate, because the whole reason we're doing this is to help you have a healthy baby. So healthy embryo, healthy surrogate is really what helps maximize those outcomes. So as far as our goals, our goals are really to try to maximize success rates, and how we do that is growing those embryos in the lab for up to 5 or 6 days to the stage that's called the blastocyst stage, and many times pre-implantation genetic testing, or PGT, can be helpful. We want to try to minimize risk. So in general, we really do advocate for single embryo transfer. We can certainly talk a little bit more about the possibility of twins. For us, generally, we advocate for single embryo transfer because we want to reduce the risk of potential complications that can occur with a twin pregnancy. And because we have such a high implantation rate for those embryos, we don't need to transfer multiple embryos to help achieve that high success rate. So the healthiest way that we can help maximize the chance of a safe surrogacy journey is really transferring one embryo at a time, and we can certainly talk further about that. And so for us, it's really important to educate the intended parent, educate the surrogate, and have everyone working as a team to make sure that everything is super clear along the way. So we're always happy to help answer questions. So COVID. The good news is, as a fertility center, we are a healthcare organization. So we have been open for quite some time, even during the pandemic when other non-essential businesses are closed. The good news is we're heading in the right direction with progress with the pandemic, but we are an essential healthcare organization. So regardless of kind of fluctuations of the pandemic, we will remain open. We have been able to move forward with many treatment cycles despite the international travel ban, mainly because of this wonderful partnership that we've achieved with clinics across Europe that have allowed us, our patients, to freeze sperm and ship it to us to be utilized for egg donation cycles. So that's been a really fantastic way for us to be able to help our international patients move forward. So one of the things I wanted to touch on is a little bit about COVID vaccinations. So there's been a lot of misinformation online, unfortunately, about COVID and vaccinations in pregnancy or prior to pregnancy. So the good news is that COVID vaccinations are safe and effective for women who are planning pregnancy. So I'm going to say it again. They're safe and effective for women planning pregnancy. So we do recommend that people receive the COVID vaccine prior to pregnancy. And there are a lot of reasons for this. So what we know is that unfortunately, pregnant women are an at-risk group for COVID complications. So pregnant women who contract COVID, as compared to non-pregnant women, have an increased risk of hospitalization, mechanical ventilation, and even death. And there's some accumulating medical literature that there's an increased risk of complications in pregnancy, such as preeclampsia and other disorders of pregnancy if a woman contracts COVID when they're pregnant without vaccination. So for so many reasons, we recommend vaccines prior to getting pregnant to help protect the health of the surrogate or the patient and the pregnancy and the baby. So we really do encourage that prior to pregnancy. There is accumulating literature that the vaccine is also safe in pregnancy, and that those protective antibodies can be passed to a baby. So that baby is getting some of the protective benefit of the vaccine as well. So for all of those reasons, we are strongly advocate for vaccination. It's not a requirement with regard to surrogacy or for patients moving forward, but it is our recommendation because we want to do everything we can to keep our patients healthy and safe. So I think that's the main thing I have. I'll turn it back over to Richard and Brad, and we're happy to answer questions.
Brilliant. Well, we have got one question for you actually that's just come up regarding the travel ban. And I think maybe Brad, maybe you can answer this. It's one of those things that we can, let me just make me the presenter again. So you see the screen. So with regards the travel ban, right? So what we have seen is a lot of our intended parents haven't been able to travel with regards doing their sperm freezing or the embryo creation, but they have been able to travel to collect their child. Brad, can you talk a little bit more about, obviously, because that kind of falls under, it's a legal remit, obviously, not necessarily you, but you've probably had slightly more than we have. So can you chat about that a bit?
Sure, and I think it's a really good topic to talk about. The good thing with our agency, we have 100% success rate. Every attended parent in Europe and even in Asia has been able to arrive for the birth. The process is pretty straightforward. About 6 weeks before your birth, we will complete some documents, you'll complete some documents, and we reach out to the local US embassy in the country that you live in. So if you live in France, we would reach out to the embassy in Paris. If you live in the UK, we would reach out to the embassy, the US embassy in London. And these embassies offer you what's called an NIE, a national interest exception, to enter the US. And that gives you a 30-day window to travel to the US. So a good agency or a good attorney will line this up for you while the travel ban is in place, and that will allow you to arrive to the US before the birth of your child.
Brilliant. And on that point, if you are looking for an attorney, of course, please ask us, because we work with a number of attorneys around the United States, all who are very, very good. Actually, on that point, Brad, so obviously San Diego Fertility Center is based in California. We have an office in New York, and intended parents, when they can travel, can do a sperm freeze in New York. Where do you get your surrogates from? Are they all California based?
So primarily probably about 60% of our surrogates are on the West Coast. So this would be California, Oregon, Washington, Utah. But we are a national agency, so we do have surrogates in Texas and Colorado, which is on the Midwest. And then about 20% on the East Coast, primarily Virginia, Pennsylvania, Florida. And that gives attendant parents the option to decide where they want their surrogate and where they want their child to be born. It's very easy for a surrogate to travel to San Diego Fertility Center for the examination and the embryo transfer, and then everything else is going to be done in their local state. So many people do like to have an East Coast surrogate, and it makes travel easier for international intended parents to travel to the East Coast.
And just to add to that, that's very common, exactly what Brad said. So we do work with surrogates across the country, and so They do need to come here for that one visit for the in-person medical screening, which only takes half a day, and they can fly right back home. Sometimes when I chat with the surrogates, they say, well, we're done early. Are you gonna head back to the airport? Like, no way, I wanna enjoy the San Diego sun. I don't wanna move up my flight. So it's just like a quick hop for them to be here and they can fly home. And then they do need to come back to the embryo transfer. But the good news is when they come back to the embryo transfer, they're here for typically only 2 to 3 days. They typically fly in the day before the transfer. We do the embryo transfer. Often they rest for about 24 hours and then fly home. So we work with the local monitoring clinic near where the surrogate lives. So it's very convenient for her to have those initial ultrasounds. We're still the captain of the ship here at SDFC, so they'll send the records to me. So I still have that continuity of care with the surrogate and I'm managing her care. And then she comes here for the transfer itself, and it works very smoothly. And we've been doing it this way for many, many years.
Brilliant. And just to elaborate a little bit with regards the travel ban, obviously we're hoping for that to go pretty soon, but we will maintain the relationships that we have with the partner clinics around Europe and actually around the world. So we've got in Hong Kong, we've got in Australia, we've got New Zealand, and obviously around Europe. And what that means for those people who are providing sperm, predominantly doing the sperm part of the process, you can do your Food and Drug Administration required blood and urine work. So it's with the blood draw, you give urine, that's shipped to the United States for testing in the US. On the same day you do that, you freeze your sperm at one of those clinics with whom we work. We get the results back from the FDA, and then we ship your sperm from Europe to the US, which obviously over the past year has meant that a lot of people have been able to move forward with their family building whilst the travel ban is in place. Now, obviously, as the travel ban disappears, it could be that some people can't take a week on holiday to go and do their sperm freeze. They can still take a day and go to one of these clinics and do that. But of course, a lot of people want to come to the clinic. They want to meet the team. They want to meet the staff. They want to see the building. They want to see where the magic's happening. So, going forward, we'll have the option to do both, although I feel that most people are going to want to go and sit on the beach in California.
Yeah, which is we're very happy that we have this as an option, which is fantastic. But I must say that was kind of one of my favorite parts, was welcoming patients to the clinic and getting to meet them in person and have them meet everyone. So yeah, hopefully that will return as an option. But as Richard says, just financially and just logistically, we completely understand it makes a lot more sense to be able to ship the sperm to us. But we hope to be able to welcome people if that's something that they would choose, if they want to come visit us in person.
Exactly. One of the other questions,
Uh-oh, Richard, are you frozen?
Yeah, it looks like for a second.
Hopefully Richard will come back. I am not able to see the question, so I don't know how to
Let me see.
pick up there. We'll give Richard a second, hopefully, to reconnect. Let's see. Oh, I just got a message that his computer crashed. So as he reboots, Brad, was there anything that you wanted to add or anything that you don't think we've touched on?
Yeah, I mean, I think, something to talk about important is kind of the matching process. And I think you hit on that really well. Selecting the egg donor. It's really important just to find that egg donor that excites you, that, has the list of qualities you're looking for. And if it's with an IVF clinic, an agency, I mean, that's really the foundation and building block. So that's a really important process in this, as identifying that egg donor. And then the surrogate process is, matching is, the IVF clinics do an amazing job. And it's important for parents just to know the qualities they're looking for in their surrogate. There's no such thing as a perfect surrogate. I mean, you've seen that. We've talked about that many times. And, I think being honest with your agency about what you're looking for in a surrogate and telling the agency, these are the qualities we're looking for. We want her to be vaccinated, or we want her to be a certain age, or, married or unmarried. These are important steps to talk to both the clinic and the agency. So we are presenting you with a surrogate because it's a long journey, right, Brooke? We know it's
100%. It is.
12 to 15 months. And this is, you want to make sure that when selecting your surrogate, this is someone you feel comfortable being with. And many times, this is a lifelong friend. This is someone that you have a relationship your entire life. A lot of times we've had sibling journeys where your surrogate 6 or 9 months after the first birth will give you a sibling journey. So it's important to really select your surrogate. You're very
Yeah, absolutely. It's so important. Richard, are you back with us?
I am back. I'm not entirely sure what happened there, but sorry.
You're fine. As you come back, the only thing I wanted to add as well, just to build on what you had said, Brad, is the importance of having that honest conversation with your agency about what you're looking for. Because if understanding kind of the pros and cons and risks, you are interested in doing a double embryo transfer, for example, in an attempt for twins, like sometimes with our intended fathers, they want to transfer the embryo from each partner. We can do that. We have done that. But then it's really important to share that with Brad, share that with the agency so that they can help select a surrogate that's open to carrying a potential twin pregnancy. And then also we can help along with Same Love to screen that surrogate, because there's certain patients who would be wonderful surrogates, but there may not be a candidate for a twin pregnancy. And so it's really important to share that with your agency if that's something important to you. And then they're going to help you find the right surrogate that is the right match and who's open to a potential twin journey.
Yeah, that's a great point.
Yeah. Richard, we can't see you yet, but I thought we could hear you.
I'm not entirely sure what's going on with my computer today.
You're back.
I'm back. Hey, there we go. But my computer crashed, and I think it might do the same thing again. There was a question I think I was about to ask about time to match with a surrogate.
So, I mean, that's a great question of what we were just talking about. It really depends on the criteria you're looking for. If you have a laundry list or a lot of wants in your surrogate, it can take up to 6 to 9 months. Some agencies are even running 12 months right now. But it's really just important to be open with the agency of what you're looking for in your surrogate. But, unfortunately, in the United States, there's probably 4 to 5 attended parents for every one surrogate out there. So, all the leading agencies in the US should have a wait time between 6 and 18 months for a surrogate. So, the best advice I tell people is, and I think this is really important, is sign up with an agency when you start your embryo creation stage, because at that stage, it does take 4 to 5 months to create embryos, and you want to sign up with an agency. So once your embryos are created, you've been with the agency and on their waiting list, because most agencies right now, especially coming out of the pandemic, have about a 6 to 9 month waiting list.
Yeah.
Well, that was all of the questions that have come through. I don't know if you guys have anything else you would like to talk about before we go? No?
I don't think so. I think just as Brad mentioned, we do have a lot of different languages we speak on our staff here. Nous parlons français, we have French speakers, we have all sorts of language speakers, Spanish speakers, and so Mandarin. So we have a very international staff to help take care of international patients. So the most important thing to us is just to help each patient. And then we know that no two patients are unique. So we want to help support you and your family building journey each step along the way.
We do. And I will be sending out contact details for both Brad and Dr. Friedman. So thank you very much, both of you, for hosting and for talking and for fantastic information. Sorry, my computer died halfway through, but hey, there we go. It's come back.
It happens.
You're like, and then he goes. And to all of you who are listening, thank you for giving up your time to listen. And of course, any questions, please, please, please reach out and ask. So on that, I think we'll go.
Take care. Bye-bye.
Bye-bye.